Some countries in Africa, like Nigeria and Algeria, are determined to continue clinical trials of hydroxychloroquine, a malaria drug in the fight against COVID-19. Uganda says it has had positive results from its use on COVID-19 patients. But the World Health Organization is shying away from this drug after the medical journal The Lancet reported that COVID-19 patients being treated with hydroxychloroquine or its related drug chloroquine were most likely to develop irregular heartbeat that may cause sudden death. The Africa CDC is now reiterating its warning.
As a specialized technical institution of the African Union belonging to 55 member states, we can only hope that countries will listen to their own organization, the guidelines. So we issued that before the Lancet published the results, or even finished the study, because we knew that this was just taking it at a certain dosage would be toxic and dangerous for people to use broadly. So we can only do what we can do based on science and evidence, and hope that countries will follow the guidance.
But the use of the drug is expected to increase on the continent. India confirmed early this month that it will be sending medical assistance that includes hydroxychloroquine to over 25 African countries as assistance for COVID-19. Separately, on the issue of vaccine trials, the Africa CDC says African countries should be participating in international research.
We as a continent have very capable scientists that have conducted vaccine trials or clinical trials over the years. And the Ebola vaccine trials in West Africa, the monoclonal antibody trials in the DR Congo by Professor J.J. Muyembe and others. Myself have done clinical trials on zidovudine and nevirapine to stop mother-to-child transmission of HIV many years ago in Cote d'Ivoire. So the continent knows how to do that. But as part of a new public health order, I'm really urging that Africa should not be just a spectator in the vaccine enterprise, but should truly be actively engaged in the entire spectrum from the R&D to the clinical trials.
Meanwhile, the continental body is concerned by Tanzania's reluctance to give regular updates over its COVID-19 updates for over a week.
The continental strategy is underpinned by the recognition that as a continent we must cooperate, we must collaborate, we must coordinate, and we must communicate. So underneath this, with this underpinning, we expect all member states to share with us data in a timely fashion. We continue to urge them to do so on daily basis so that we can at least know what is going on. We are only as strong as our weakest chain.
Tanzania's opposition politicians have accused President John Magufuli of covering up a major outbreak of COVID-19 in the country. Colette Wanjohi, SABC News, Addis Ababa, Ethiopia.